Dr. Vidal, and we are back with Tuesday Tips. Thank you so much for logging in every week, for sending me your questions. This is our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. And today we're wrapping up the month of August, which the topic was breast lift and breast augmentation. Specifically breast lift and the combination of breast lift with breast augmentation. So today I'm going to be kind of going over the topic in general and focusing on two things that I didn't mention in other lives that are very, very important for this surgery. One is the preparation, how to prepare for the surgery, and the other one is the addition or the usage of an internal bra mesh. So all over who's a candidate, who should use it, and what's the mesh. And then we'll go into the Q&A for anyone, for the questions that you send me through the stories, and anyone that has questions in the comments, okay? So breast lift, like I mentioned in the prior lives, can be done through a periareolar or donut incision. It can be done through a lollipop incision, which is a periareolar and a vertical, or what's called a Weiss pattern or anchor type of lift, which is around the areola down and in the fold or the inframammary fold, depending on how much droopiness you have. Everybody's different, so you can't compare your implant size with another person because the amount of skin resection, the amount of breast tissue, and the density of breast tissue varies significantly from patient to patient. So it is a combination of things. What's important to choose an implant that goes with your body and kind of gives you the look that you're looking for. So the important message when we're doing a breast lift and a breast augmentation that I always want to give to my patients is that you can't put a large implant from the first surgery, because these two procedures are basically opposites in terms of the breast lift kind of tightens everything up, the breast implant adds volume, and we're adding volume and lifting a large amount of lift. That means that the distance between your neck and your nipple is very long, then we can end up in problems. And what are the problems that we're trying to avoid? One is nipple necrosis or loss of the nipple because the blood supply gets compressed by the implant and the rotation of the lift, and then we lose the nipple. The other one is wound dehiscence or wound opening. The implant has too much tension on the closure and the wound tends to end up, and we end up losing the implant because it's exposed to the environment. So those are the things we want to avoid, and sometimes that requires two surgeries. So it is important to keep an open mind, and when I do suggest you go through two surgeries, it's not because I want to make it harder for you, it's because I'm concerned for your safety, right? And concerned that we're trying to avoid those, okay? So let's focus now on the preparation for surgery. What are the things that we need to do specifically when we're going through a breast lift procedure? And I'm not gonna go over all the things that you should do in preparation for surgery because I have a live focus on that, you know, like nutrition, exercise, like BMI, all of those things, medical conditions, labs, all of that preparation for surgery in general, it's a full life, and I have it separately. Today, I'm gonna focus on all of that you should do for a breast lift, but specifically, what are the things that you should consider preparing for when you're going through a lift? So one of those is you are not allowed to lift anything heavier than 10 pounds for 6 weeks. You're like, okay, I won't work out, that's fine. But what are the two things that for us women are harder when we say no heavy lifting for 6 weeks? One is your work. So depending on the job that you do, you may need to lift stuff, right? So if you're a nurse and you need to move patients, if you're a police officer, depends on your line of work, you should plan ahead so you can have, majority of patients after breast lift can go back to work at 2 weeks, but with the restriction of not lifting anything heavier than 10 pounds up to the 6-week mark. And that may involve some adjustments in your job, in your work environment, okay? So think of that. And the second one is babies. So if you have a baby and you are the primary caregiver for that baby or that kid, you need to adjust or you need help because you won't be able to lift them for 6 weeks, okay? It doesn't mean that you can't hug them, that you can't put them in your, like someone can put them in your lap. You can sit on the couch and have the baby come over. If it's a toddler or a bigger kid, they can come and sit in your lap, that's fine. You shouldn't apply any pressure to your chest, and you shouldn't lift them up from the floor, because that does two things. That activates our pectoralis muscle. If you have implants, that pectoralis muscle is squishing on the implant. Once it pushes on the implant pulls down towards the incision, and we can have wound healing problems. And the second one, when we move the arms, the skin is also tensing and stretching. So that puts tension on those incisions that may end up with wound openings, okay? So that's a very, very important thing to prepare for when you're coming for surgery for a breast lift. The second one is your sleeping position. You are gonna need either a recliner, an adjustable bed, a wedge, or extra pillows. Any of those is good, but you should have your back elevated at least 30 degrees. So if you're sleeping, 30 degrees looks something like that. You know, from the bed, at least 30 to 45 degrees inclination. So, and your head is here, okay? So if you have a recliner and that's more comfortable for you, wedge, pillows, any of that, you should be elevated for 2 weeks. And the other one is on your back for those 6 weeks. If you're sleeping on your side, if you're sleeping on your chest, you're applying pressure to the implants or the incisions, and we may end up with problems. What is the other problem that can happen when implants are placed and you start to sleep on your side or your chest too soon? The capsule that forms around the implant takes time, and that capsule forms with every single implant, and it's not a problem unless it becomes symptomatic, and that's what capsular contracture is. But the capsule is actually our friend. The capsule, a healthy capsule, keeps the implant, it's like an internal bra, it keeps the implant in place. If we put pressure to the implant too much in the initial post-op period, that capsule is going to become very stretched. What does that mean? When you're laying down, then in the future, the capsule is not going to hold the implant in place in your chest, and the implant can go to sideways to the axilla, or when you're standing up, gravity pulls the implants down, okay? So we want that capsule to be snug to that implant, so when you're moving around later on, that implant stays in position, okay? So plan ahead. If you're a side sleeper, if you're a belly sleeper, you have to adjust, because for 6 weeks, you're gonna be sleeping in your back, okay? T-Rex arm, what is that? So your elbows should be close to your body as much as possible for the first 2 weeks. Range of motion of elbow to shoulder is okay. Well, this is fine. So you washing your face, washing your hair is okay, but your elbow shouldn't go past your shoulder level for the first 2 weeks. When we elevate your arms above the shoulders, that puts tension on that incision, wound healing problems, widening of the scar, darker scars, all of that hyperpigmentation, okay?
So you can explain.
You see, T-Rex is a very, very cute dinosaur that has little tiny arms, and his range of motion is like this. So that's why I call it T-Rex arms. Okay? So plan ahead. So if you're, for example, if your caretaker is leaving you for a couple of hours to go shopping, and the only glass of water that you have is in the highest cabinet, you need to adjust. Those are the things that you need to think of when you're preparing for surgery, to have it available in a range of motion that you don't elevate your arms above your shoulder level. Okay? What is the internal bra? The internal bra is a mesh. We've seen a lot on social media recently about this internal bra, miraculous internal bra. And I don't use it for every single patient, because I don't think that every single patient needs it. But I think that is very beneficial for basically 3 patient populations. One is massive weight loss patients. When we have massive weight loss, the elasticity of the skin has been altered. Collagen, elastin, and the ability of the skin to hold weight, it's altered. So the internal mesh gives that extra support for the breast tissue and the implant to prevent recurrent droopiness or recurrent ptosis. The second patient population is very skinny patients. So even if you haven't had a very large weight loss journey, if you're very skinny and your breasts have a lot of stretch marks, you may be a candidate to consider a Galaflex or an internal bra from the first surgery. And the third group of patients that I think are very, very beneficial to add this are patients that have had a breast lift and implants in the past, and they have dropped or bottomed out. What is bottoming out? So when we do a breast lift, we put the implant and the breast and the nipple, so the implant is basically behind that nipple position. With gravity, this implant starts to stretch what's called the lower pole of the breast. So we end up with a nipple that is in the right position, but this is elongated and the breast looks like it's droopy, but the nipple seems to be in the exact same position. It's just the lower pole of the breast stretches, which causes on a side view to have the nipple in the correct position, but this area very droopy with the implant down here and a flat chest or lack of upper pole fullness, okay? So if you experience this or you have this, not only redoing the lift and doing what's called a capsulorrhaphy, which is tightening that capsule space to kind of bring the implant up, but also adding that internal bra or mesh to support the lower pole so this implant weight doesn't kind of stretch that lower pole and we have recurrence of the same issue, okay? And what is an internal bra? It's a mesh, okay? The one that I use, there are different types of meshes. The one that I use because I think is the most effective and also the most cost effective in the market, it's called Galaflex. Galaflex is a completely absorbable mesh, but the tissue that is left behind is a stronger, thicker tissue, which means that you don't have a permanent mesh in your tissue long term. By a year, the mesh completely is absorbed, but that tissue that is left behind, it's what's basically holding up the breast and the implant in place. So I think it's a very safe mesh because it's absorbable and doesn't leave any permanent material in your tissue. But it's been proven to give extra support in that lower pole with gravity, which is the one that basically holds the excess weight in the breast tissue. So it is not included in every breast lift. It is an add-on. I do recommend it in some patients, like I mentioned, those 3 patient groups from the beginning. But if you want to be extra cautious in the sense that you want to try to avoid droopiness or recurrence, you can ask for the Galaflex mesh. It's an added cost because the mesh has an extra cost. And it can be added to a breast lift procedure if you're interested in this. It can be added to just a breast lift or just a breast reduction. You don't have to have an implant to get the internal bra, okay? It can be just to support your breast tissue, especially in patients that have very dense, heavy breast tissue, okay? So if you're interested in it, you just tell your coordinator and she can give you a quote. If you're not sure if you would benefit from it or not, you can tell your coordinator and your coordinator will talk to me and we can either do a virtual consultation and go over it, you can come in person and go over it, or I can give you a recommendation your coordinator will let you know, okay? So I think that wraps up what this month we've been talking about. I'll take some questions now if you guys have it.
Okay, I think you should talk about the internal bra in Spanish because we have a lot of questions. So can you wrap up about it?
Of course. So
Ay, te lo dije en inglés.
Sí. That's okay. So el brasier interno, voy a explicar ahora, lo expliqué en inglés, ahora lo voy a explicar en español para las personas que hablan español. El brasier interno es básicamente una malla que es completamente absorbible. Hay distintas mallas en el mercado, pero la malla que yo utilizo y la que recomiendo se llama Galaflex. Es una malla que es completamente absorbible y también no es muy costosa y es costo efectiva en el sentido de que tiene muy buenos resultados y que la seguridad o el panel de seguridad de la malla es excelente porque no es permanente, no se queda el tejido permanente en el seno. Tu cuerpo lo absorbe, pero se hace una reacción en el tejido, que el tejido que queda residual es mucho más fuerte. Eso básicamente crea como una capa de tejido de cicatriz en donde la malla estuvo, que hace que soporte o que apoye el tejido del seno. Puede ser con un levantamiento con un implante, puede ser un levantamiento solo o un levantamiento como una reducción, perdón, con un paciente que tenga mucha densidad de seno. Los 3 pacientes que yo recomiendo que añadan lo que es el brasier interno o la Galaflex con el levantamiento de seno es pacientes de pérdida masiva de peso, porque la elasticidad de la piel se ha perdido, pacientes bien delgadas que no tengan mucho colágeno en la piel. ¿Cómo sabemos esto? Porque tengan estrías en el tejido del seno. Esos son signos de que no van a aguantar un implante. La malla interna te puede ayudar a proveer ese soporte adicional. Y el tercer grupo que sí lo recomiendo son pacientes que ya hayan tenido un levantamiento de seno y que tengan caída del seno o que el polo inferior del seno se haya estirado tanto que el implante se baja en la parte inferior y el pezón y la areola se ven como alto y planito arriba. Para corregir eso hay que reparar la cápsula, traer ese implante hacia arriba, pero hay que ponerle un soporte o algo que apoye ese implante y la malla de Galaflex es excelente para esto. So, no lo añadimos a todos los procedimientos porque no todo el mundo lo necesita. Hay pacientes que yo se lo voy a recomendar la entrada. Si a ti no se te recomendó, pero tú quieres saber un poquito más y saber si tú eres candidata para eso, puedes pedirle a tu coordinadora más información acerca de la Galaflex y ellas te pueden explicar. Puedes pedir una consulta virtual conmigo o una consulta en persona y yo te explico si tú te beneficias o no de la malla.
Okay, do you feel safe doing an implant augmentation and a BBL together?
I don't like to combine these 2 procedures, and it's mainly because of safety issues. The amount of liposuction I can do when I'm doing an incisional procedure like a breast augmentation or a breast lift is 1 liter. I don't think that's enough to give you here in Florida, right? These are the laws that I have to go by, which is here in Florida in an office-based surgical facility. So I don't think that's enough to give you a result that you want. So I like to stage them, and the second one is the recovery. So for a breast augmentation, I'm going to ask you to be sleeping like this, and for a BBL, it's completely the opposite. I don't want you in your butt, I want you in your belly. So I don't think that you can safely and comfortably do both procedures, prioritizing the recovery of both.
Hola doctora, estoy súper feliz con mis resultados.
Qué bueno.
6 días hoy de mi operación. Yasmín.
Qué bueno, Yasmín, estoy súper contenta, qué bueno que estás recuperándote súper bien y contenta con tu resultado y se va a poner mejor. Deja que esa inflamación baje y todo se va a ver mucho mejor.
Last question. Si tengo densidad en los senos, ¿es recomendable una reducción y en qué me ayudaría?
So, sí, o sea, la densidad del seno lo que te provee es mucho peso. So, la mayoría de los pacientes que tienen alta densidad se quejan de dolor de cuello, dolor de hombros, de que los brasieres les molestan en el hombro. A veces tienen hasta rash o problemas de picazón en el pliegue. Y todo esto mejora con una reducción de seno. Así que sí, definitivamente, si esos son los problemas, la reducción sería la contestación.
Puedo usar la malla sin implante, ¿verdad?
Sí, correcto. Una de las opciones es utilizarlo sin el implante y básicamente la malla, cuando se hace la reducción, se pone en todo el polo inferior aquí, dándole soporte al tejido del seno para evitar que se vaya cayendo con el tiempo. Lo que pacientes que no tengan mucho volumen, no creo que haya mucha diferencia en términos de longevidad del levantamiento, pero sí, si son pacientes con mucha densidad de seno, bien pesado, pues sí hay un beneficio.
Ya voy a cumplir 4 semanas de recuperación y me he sentido mejor cada día. Gracias, doctora Vidal. Cristal.
Qué bueno, Cristal, súper contenta y definitivamente hay veces que nos enfocamos en esos primeros días postoperatorios y pensamos que yo me siento súper mal, ¿por qué me hice todo esto? y no es hasta eso que llegan ya como al mes y medio, que son las 4 semanas, 6 semanas, y empiezas a ver cuando toda esa inflamación baja, lo bien que se estás viendo, lo bien que te estás sintiendo, cuando te empiezas a poner esa ropa que nunca te puedes poner, ahí es que finalmente se siente la razón por la que pasamos todo esto.
Doc, muchas de las preguntas las puedo resumir en ¿cuál es el costo de una cirugía de seno? ¿Cómo podemos explicar que cada uno?
Aquí vamos a poner el website. El website es pureplasticsurgery.com. En este website ahí pueden ir a lo que se llama Virtual Consultation Form. Entran ahí, está en español también, así que lo pueden cambiar con la banderita de España. No es que yo sea española, pero ese es el indicio de que lo cambiamos a español.
Y vamos a poner la de Puerto Rico.
Sí, la de Puerto Rico, la de Cuba, la de Venezuela. Pero nada, le dan a esa banderita, te lo cambia a español y ese formulario nos va a dar más información. No te puedo dar un costo porque todos los pacientes son diferentes dependiendo de lo que necesites. Si necesita mallas, si necesita implante, si es una reducción, si es un levantamiento, si es un aumento solo. Así que todo va a depender de lo que necesite. Hay muchas que lo combinan con el tummy tuck, que ese es el mommy makeover. Hay muchas que lo combinan con liposucción del 360 si el BMI es bajito, que es el Miami makeover. Así que hay muchas opciones dependiendo de las áreas que tú quieras buscar, que tú quieras mejorar. Esto es sumamente fácil porque tú lo llenas, es súper sencillo, nos mandas 3 fotos y una coordinadora va a estar contactándote en 3 a 5 días después de que yo evalúe la información y yo diga cuáles son las recomendaciones. Una vez y todo esto es libre de costo, no tienes que pagar nada, te mandamos el quote o la cotización de cuánto es la cirugía y ahí entonces tú decides si quieres dar el depósito para reservar tu fecha. Se acabó. Bueno. Antes, a ver, Willy, ven la mano de Willy. Ok, Willy, lo voy a decir. El flash sale termina este viernes. ¿Qué es el flash sale? Si vas a reservar una cirugía que lleve implantes, te vamos a regalar los implantes.
¿Qué?
Y condiciones aplican, porque si no digo eso, Willy me regaña. So, before finishing the live, I can't finish the live without reminding you guys that we have this awesome flash sale that is only for this week. So you just have 3.5 more days to take advantage of this. It's basically if you're booking any procedure that involves implants, we are gonna give you the implants for free. So this is a major advantage. Take this opportunity. Book your surgery and take advantage of this. Don't miss it, but conditions apply because Willie is gonna.
And they have to look out the post that says flash sale with all the information.
Okay.
Busquen el post que dice.
Okay, like that post, okay? Like it. Okay. And that's it. Thank you so much, you guys. Next week, I'm not gonna be joining for Tuesday tips. I'm gonna be out for next week, Labor Day week. So I'll be back the following. I hope everyone enjoys their long weekend with family, friends. Keep it safe, and I'll see you guys in 2 weeks. Take care.